right, guys. So if this is your first year selling Obamacare, ACA, major medical, this might be news to you, but open enrollment starts about a month from now, okay? November 1st, the floodgates open, and that is to sign people up for plans starting January 2024, okay? Now, our current administration has extended what used to be a 45-day window for open enrollment, right? We used to always have November 1st to December 15th. Well, we now, for the last couple years, have had that extended to January 15th. And then depending on what states you live in, like I'm in California, we always extend it further from that. So like we'll probably go to January 31st. Some other states will follow suit. But for the most part, the federal open enrollment is November 1st to January 15th. We've got to sign everybody up in that window. As we know, Americans, myself included, are procrastinators. That's just what we are, right? So you guys as the agents need to be prepared, okay? And you need to help us procrastinators by making sure that you're organized, that you're sending everything out ahead of time, reaching out to your clients ahead of time, making sure they're prepared for open enrollment to be able to make those decisions, okay? Very, very important stuff there, because we already know come January, there's going to be those people that were just kicking the can down the road, and you don't want to be the agent that let everybody kick the can down the road, and now you're overwhelmed the last few weeks of open enrollment, okay? So let's make sure we're planning properly here and reaching out to all of our clients right now, making sure they know what their options are, that they know that you're going to be reaching out to them come November so we can get those sales lined up, okay? My first important slide here is quite important, guys. If you have been living under a rock or you're just new to Obamacare or insurance, big thing here, there is a new consent requirement for all ACA sales. Now, don't worry about this too much, guys. Your upline should already have this under lock, under wraps for you guys. So like, depending on which agency you report to, there is going to be a process flow in place. If there isn't, if your upline doesn't have one, CMS.gov has a little form already made for us as well. So you can get that there. The big thing, we need to know who we've got consent for, whether it's an individual, an employer, or an employee, what date the consent was given and what date it's to, and then, unless it's forever, and then who you are that consent is being given to, okay? And then we've got to retain these documents for 10 years. So some systems will keep that for us. Some of them, you got to keep these documents yourself. Work with your upline to figure out what your process flow is for that. For those still just trickling on in, because I see some of the numbers going up, we just had a snafu with the Zoom. We had to quickly rebuild Rome in about 2 minutes, and we got this back up. You did not miss anything, I promise you. We just started 3 minutes ago, okay? So you're good to go. This is the first important thing here, ACA consent. If you guys are unaware of it, make sure you get yourself aware of it. Speak with your upline on what that process flow. Some of you, like if you're HST, you'll have Lead Master. That'll have it rolled into there. Just to, again, CMS.gov has the document form for you. You can create your own as well. There are a million different ways to resolve this issue. What our general rule of thumb we're going to say is, why don't you guys just do this consent form for every customer, right? Whether ACA or not, just make this part of your process flow now, because you don't know, are you going to need to maybe move them to an ACA plan in 6 months, in a year, anything like that? So very, very important. Yes, Marcy, or attestation, acknowledgement. But yes, so Marcy asked, does it need a client's signature? Yeah, it's going to need the client's attestation or acknowledgement depending on how we're doing it, right? It can be an electronic signature, but we are going to need a customer to sign consent. Yes, great question. All right, guys. Couple of these slides here that I'm going to hit right now. Some of these are going to be review for you, but some of the information's updating, okay? So let me kind of go into what does the Affordable Care Act cover. Oh, my cat's trying to get out. 1 second. Here you go, bud. Here you go. Sorry. All right. So big thing here, guys. Remember, Obamacare, it's guaranteed issue, right? So whatever stuff your clients have and are bringing on, we'll take them, okay? That means there are benefits for pre-existing conditions. Whatever that stuff you might be bringing on with you, ACA rules that we'll take it, okay? We will take that with us here, okay? No lifetime limits. Guys, your customer can get cancer on a short-term medical plan, and then when we've got to renew, move them to an ACA, and don't worry, we've got coverage for them. They are protected now. No lifetime limits, guaranteed acceptance on that plan, okay? Some amazing things about ACA, right? There are a lot of customers in the United States that is just going to make sense for, right? A lot of our customers that's just going to make sense for, right? So important stuff there. The metallic levels don't really matter as much. I'll touch on that a little bit later on just different ways to present information to your clients, but don't worry about the metallic levels as much. Those are just sorted by the deductible, the benefits, things like that. But we'll kind of go into how to present that to your customers in a few slides here, okay? This is a change that happened this year. So for those of you that were writing ACA last year, you guys know that it was $9,100 was your maximum out of pocket for an individual, and it was $18,200, double that, for a family. Well, guys, those numbers, as we've seen since Obamacare came into be, those numbers keep rising. So now for an individual like myself, if I get a bronze ACA plan, I can expect to have an out-of-pocket maximum each year of $9,450. Make sure you're addressing that with your client. Do they have 10 grand in the bank in case they need to use insurance this year? Okay? And if you got a family, make sure you got 20 grand in the bank, because $18,900 is now the family maximum out-of-pocket set by Obamacare, okay? Guys, these numbers rise every year. They're continuing to rise every year. Wayne, there are no specific ACA marketing materials available for this section. Maybe each carrier that comes might have some handouts, but I'm not going to promise that for the carriers. So we'll touch on that as they get here, okay? Remember, guys, we're talking good and bad, right? Every plan has holes in it and has some amazing things about it. So we talked about guaranteed issue, pre-existing conditions covered, no lifetime limits, some great benefits. We also have these essential health benefits, okay? Now, depending on your customer and who you're talking to, some of these are amazing benefits, right? Some of these benefits are things that we can all get behind, right? 100% wellness coverage. A lot of the United States loves that. I mean, a lot of the United States loves that, and that's a really good thing to have on there, right? Now, maternity. If you're my age, that's a really good benefit. I love that maternity's covered and included. I'm going to pick on a couple people I love in this chat. What if you're Kim and Dave McPherson? I don't think they're trying to have more kids. I mean, knock on wood, I don't know. But if you're, depending on where you're at, maybe paying for, yeah, Dave's like, no, Nick, don't wish that kind of evil on me. Maybe you aren't wanting to pay for maternity, right? So these essential health benefits for every customer, they can be a big positive and a selling point. Some of them, it's irrelevant to that particular customer, right? But understand what they are, and yeah, right? So just understand like how these work, right? And understand that depending on the customer you're talking to, it could change the value of some of these essential health benefits, okay? Remember this 80% MLR. What that means, guys, in layman's terms, it said, hey, all states United Healthcare, who's coming up next, all of you carriers out there, we're going to have a rule on you. Every dollar that you bring in for premiums, so what your customers are paying for their plans, every dollar the carrier brings in, 80% of that, so 80 cents of every dollar, needs to be paid out to claims, okay? So it's good heart, great heart there for the American public. Now, for us, the insurance agent, if any of you guys have been in this industry a decade or more, that meant our commissions got cut, because our commissions used to be 25, 30% on some of these plans. Well, if you do some math, 80 and 30, we're over 100, right? So you saw commissions got cut. Those are now starting to work their way back in, and we get those flat rate commissions. But essentially what this is saying, Allstate, United Healthcare, Aetna, everyone, you guys have to operate on 20 cents to every dollar you bring in. So the CEO salary, paying the electricity bill, paying for your properties that you have, and paying you guys, right? So that is what the 80% MLR is, okay? Great heart behind it. I think it was great for the American public, but we got impacted on it, right? That's going to happen. And then, guys, talk about good and bad, right? If you make too much money, this can be considered bad because you're paying the tax dollars to pay for these subsidies, right? But for the vast majority of the American public, these subsidies can be considered a great thing, right? And I'll show you guys in a few slides the federal poverty level chart and where that stuff falls. Guys, you can make almost $100 grand a year for a family of 3 and still potentially qualify for some subsidy. That's crazy. That's some really good stuff. And so there's a lot of people out there that can get subsidy benefits, which really make these plans important, right? Cool. Couple other things you guys need to know about and what we need to explain to our clients, okay? What are our clients buying when they're buying insurance? We need to make sure they understand how it works, right? So the first thing in that, how is it going to work when they go to the doctor? How is it going to work when they get their prescriptions filled, right? Are there copays on the plan? Does it just roll up to the deductible, which some of it does? That $9,000+ deductible, right? We have to make sure as we're explaining how the plan works to our client that we touch on those things. Those are very relevant things our customers are going to use on their health plan, right? What's next? To me, this is the most important one. It's the network, right? Our clients need to understand networks, okay? You guys need to know what that means is what doctor you can go see, what hospital facility you can go to, okay? That is the network. And so you need to understand what network is on the plan that we're putting this customer on, and how can our customer expect that network to work? And then you see it in yellow there, what happens if the provider's out of network, right? We need to make sure that our customers are aware of these situations because this is how people use health insurance, right? You need to let them know their exposure, right? What is their out-of-pocket exposure? This is information for everyone, Sandra, but yes, definitely for first-year agents, but for everyone. Make sure you guys understand and let your customers know this is what you're going to pay if you have a rough year, right? If stuff hits the fan, this is what you can expect to pay, okay? And then those essential health benefits we talked about. Again, pick and choose these ones based off of when you're doing your discovery with your clients, right? You don't want to a 60-year-old, you don't want to talk about maternity benefits, right? It's irrelevant. So leave that on the sideline, but maybe wellness is very important to them, right? Maybe prescription drugs is very important to them, right? So make sure you're picking and choosing which of the essential health benefits we're going to talk about, and then Are they paid for or are they covered? A lot of customers get confused in that stuff, right? Are they paid for or are they covered? Okay. And that just means if it's covered, cool, you can go get that done, but you're still going to pay for it. It's going to go up to your deductible. Okay. A lot of times customers can get caught with that. Okay. We'll talk about subsidies, guys. There are 3 factors for getting approved for a subsidy: your household income, your family size, and then what zip code you live in. Oftentimes, people confuse age with this. Age is not a subsidy determining factor. Age changes the cost of our health plans, right? So me at 35 years old, my health plan is going to cost a little bit cheaper than somebody at 60 years old, right? So we might both get approved for a subsidy based on our income, family size, and zip code, but maybe my subsidy is only $100 and the 60-year-old gets a $500 subsidy. Age had nothing to do with them getting approved, but their health plan costs different. So they're going to get a larger subsidy to bring them down to the same price as me, assuming we have the same income, family size, and zip code. Okay. Here is the federal poverty level chart. You can screenshot this if you want, but you really don't need to memorize it. You can enter their income into any of the systems and it'll estimate this stuff out for you. This is also public information. You can find this on cms.gov. That's actually where I found this chart. What I want to call out here for you guys, you'll get a subsidy up to 400% there, okay? Look at this, guys. A family of 4 can make 120 grand a year and still potentially qualify for a subsidy. Guys, that is a lot of our customers. A lot of people in America fall under that, right? So they've really opened this thing up to where the vast majority of America are going to qualify for some sort of subsidy to get help paying for their coverage, okay? Now, if you guys don't know about cost sharing, these are only on our silver level plans, and it only goes up to 250% of the federal poverty level. But if you have a customer that qualifies for a cost sharing reduction, you need to talk them into the silver plan. They might have a bronze plan at $0 or $50. You need to talk them into the silver plan for like $100, okay? It's very important. And why we need to do that, guys, their deductible is going to be reduced. Their copays are going to be reduced. Their out-of-pocket is going to be reduced. So you need to do the whole year for them. Show them. You're going to pay $50 more a month or $600 more a year, but your deductible, your out-of-pocket got taken down $7,000. $600, $7,000, right? Just let the math for your client, right? But it's very important you guys call that out and show that to them, because as we know, most of our clients want free or they want the cheapest. And we know you get what you pay for, right? And so sometimes it makes more logical sense to spend the extra $50 right now a month. Heaven forbid something happen and you're spending an extra $7 grand, right? Very, very important. Let's see, we got a QA here. Yes, so Tina asked, will we get a recording here? Absolutely. We are recording this, and so we'll make sure that this will be sent out to all applicable parties as well, okay? So these next few slides here, guys, are really about how to present this information to your clients, okay? These next 3 slides are going to walk through an idea of quoting on Obamacare, okay? I've been sent around to a lot of agencies this year talking about how do we get more supplements in our ACA sales, because our Obamacare customers are always looking for cheaper, right? What's the cheapest cost? And so how do we open up that conversation? And so that's what this next few slides are about. Guys, every single call that you are doing with your prospective clients needs to let them know what are the cost factors, what are the main terms in insurance, and how does it work, right? So what is their premium? They need to know that. And guys, the funny thing is, you can ask any customer, do you know what the premium is? They'll say yes. Do you know what the deductible is? They'll say yes. Do you know what co-insurance is? They're going to nod yes. And do you know what the maximum out-of-pocket is? They'll say yes. And then you'll say, can you tell me how this plan is going to work with your deductible into co-insurance going into your maximum out-of-pocket? And they're going to sit silent with a blank look on their face. Actually, shoot, I've seen a bunch of agents that have been licensed for years sit with a blank look on their face when I ask them that question, right? So it is very, very important we explain this and break this down in very easy to understand terms for our clients. The deductible, right? That is, and this is how I explain it, guys, because for whatever reason on health insurance, the American public, our brain goes dumb on deductible. You tell them, do you know what a deductible is? They say, yeah, I've got car insurance. Okay, let's use that same example. So on your car insurance, your deductible is $500. So you get in a car accident, you have to pay the first $500 before your car body is going to get fixed, right? Cool. So let's use that the same way on this plan. Your deductible is $9,450. How's that going to work? That means you break your leg. You go into the hospital because you think you might have a tumor. How's that going to work? That means you are going to pay the first $9,450 before the insurance company will jump in and fix your body. And you say that and eyebrows raise. I don't know why it is, but the American public looks at a health insurance deductible differently from their auto insurance deductible. Well, I actually do know why. Most of us do not hit our health insurance deductible every year. We do hit auto insurance deductibles, right? So we actually, that's a more relevant example. But in our brain, we're like, I had to pay $1,200 last year for getting some work done on my body, right? Yeah, you just didn't have something serious enough to go all the way to $9,450. But you understand, your insurance company's not touching anything till you pay $9,450, right? Now, if your deductible happens to be less, let's call it a $6,000 deductible, your ACA plan is going to have co-insurance. Might be a 70-30. What does that mean? That means after you pay that $6,000 deductible, you and the insurance company are going to split bills now up to that $9,450. And the insurance company will pay 70%, you'll pay 30%. So another $3,500 essentially that you'll be paying 30%, or you'll be paying all $3,500, but you'll get another times what, I don't know the math on that, but all the way up to where your 30% is on that. Okay. Very important that we make sure our customers are going to tell us, yes, I get it. You need to break it down into terms that's so easy to understand for them like that, because they get it, but they don't get it, right? And we're here to protect them from the whoopsie, from that, oh, I thought I was going to have a good year here, and then something happened, right? Because guys, and I know a lot of you on this call, we've been the insurance agent on the other side of that call where we were lazy at the sale, and now they have that $9,450 bill, right? I know a lot of you, I see these names in here. We've been on the other side of that customer service call. That's a mistake you'll only hopefully make once, right? Because that customer service call for that customer is a lot worse than putting up a 1-minute battle at the sale, imploring them to not make a bad decision because of the risk, right? Make sure you guys are doing that, all right? Here's a little bit more information on the networks really quickly. PPO networks, in my opinion, the best networks out there. You get to choose where you're going to. You don't need to go to that gatekeeper, anything like that. But they're few and far between, and they're very hard to find on ACA plans. You guys know that. POS, we don't really see, so I won't touch on that a ton, okay? These two on the right are, so the question was asked, so coinsurance would only be if the deductible is less than $94.50, correct, or if it's a family up to that $18,900, correct. Since the government has set that as our maximum, no matter what, that's our maximum. So coinsurance will only come into play if they have a lower deductible than that. That's a great question. You're exactly right on that. So EPO and HMO are the networks we're going to see most often on our Obamacare plans, on our ACA plans, okay? EPO sounds really cool. It's playing on the PPO name, and it's an exclusive provider organization. Guys, it is so exclusive, they are generally either state-specific or county-specific. So if your customer travels a lot, it might not be the right option for them. EPOs will sometimes take advantage of a hospital or facility in other states or major cities. But if you break your leg on a hiking accident, you're going to have to get traveled all the way into the closest major city to hopefully get help for that. Actually, no, on an emergency, there's usually coverage in there, okay? HMOs, you're going to get customers that love them. You're going to get customers that hate them. I'm a big fan of them if my customer is. If you ask me personally, I'm not a big fan of them, right? So it just depends on what your customer's saying. But an HMO is that one where you got to go to the gatekeeper, right? So you got to go to your family doctor first before you can go see a specialist. I'll use an example for me. I had Kaiser Permanente, huge HMO on the West Coast here. I broke my collarbone into 4 pieces, got the x-ray at the ER. I still had to go to my family doctor, let them look at the x-ray, and that took 2 days for them to say, oh yeah, it's broken. Thanks, doc. I kind of got that one. And then I had to schedule an appointment to go see a shoulder specialist. It took me 6 days with a broken collarbone before I was in seeing a shoulder specialist. Okay? That is very, very important. Yes, Tony, the recording will be available. So you guys need to know that with HMOs. But I talk to a lot of older people who love HMOs. Because they're not traveling a ton. It's got all their prescriptions in-house right there in a cheaper network. All their doctors they want to go see, they just schedule an appointment and they're good to go. So just depending. I'm never going to talk a customer out of it if that's what they want. Understanding how it works in Obamacare. HMOs are the cheapest because you're all in this family network. And then EPOs are going to be a little more expensive. Okay? So understand that. Yes, Laura said most HMOs are preventative in nature. That's exactly right. They're here to get you healthy for cheap and get you on your way, okay? That's very much what they are. But again, if my customer loved them, I love them too. Big fan. If you're asking my personal opinion, not a huge fan, okay? Now, guys, this is going to be one of my last slides for you here, okay? I need you guys to understand this is what I do on any ACA sale. This is my flow, okay? I am not planning on selling my customer necessarily either of these 2 plans, but every customer that I am going to present to, and guys, this quote is from August of this year. We don't have next year's plans ready yet, so forgive me on that, okay? Every single customer is going to get a comparison between the cheapest big name, I'm not going to use an off name. I'm going to use the cheapest big name ACA carrier in their market. So Florida, I'm using the Florida Blues, right? What is the cheapest bronze plan and what is the cheapest silver plan? And what I'm trying to do here, guys, is open up the cost conversation with my client, okay? So I'm going to show them if you don't get a subsidy, which hopefully they do, but if you don't get a subsidy, your cheapest bronze plan for a family of 3 in Florida is almost $910 a month. And that's for this last year. Maybe that goes up, probably goes up. And what does that do, Mr. and Mrs. Customer? Well, your deductible is $9,100. So if anything happens to you this year, you are paying the first $9,100. Granted, you'll get a network discount, so you'll get a 40 or 50% off the bill, but you're paying all the way up to $9,100. What happens if I go to the doctor? Oh, you see it's 0% after deductible. What does that mean? That means even going to the doctor, you're going to pay all the way up to $9,100, and next year $9,450. You are going to pay the first of that until you hit your deductible. Then it's 0%. Then the carrier is going to kick in and pay for you. Okay? And this is on an HMO network. So let's get you a better plan. Let's get you the silver plan here. Okay? Look at this. The cheapest silver plan, a little over $1,100. So we have gone up $200 a month, but your deductible got cut in half. It's now only $4,000. Your out-of-pocket maximum stays $8,000. So we are spending $200 more a month to save $1,000 a year. This is how I do the math for my clients. Math always maths, guys. So look at this. I point out $8,000 maximum out-of-pocket to $9,100. So we saved you $1,100 on the year. Anybody a math nerd can tell me what $200 a month is. That's $2,400 a year. So my customer, to move up to a silver plan, is going to spend $2,400 more a year to save $1,100 out of pocket. Does the math math? It doesn't. So why is my customer going up to a silver plan in this situation? I couldn't tell you. Maybe it's for a $20 specialist visit on a copay. Maybe. Well, yes, and William, Bill Morrissey, you're exactly right. You would use the family deductible here. This is just what's showing on my screen, and so I'm just running with that. But you're exactly right. You would actually use $18,900 because this is a family of three, right? And so over here it'd be $16,000. But we have to have that conversation with our client. Does this make sense? Does this math? Is it worth what you're paying for? And if it's not, and usually it's not, this is where we've opened up the conversation now to say, hey, let's get you the cheapest bronze plan, and let me use that $200 of savings to put some supplements in place to where you're not even going to know that you have a $9,000 deductible, right? That is how we do it, guys. So on ACA sales, show them where is the risk, where is the exposure, and what is the cost savings on bronze to silver. And if the customer thought it was hot going up to silver, explain to them, what if I can take that deductible down to $0 or maybe $250 in case of an accident? And I can probably build that plan out for cheaper than the silver plan with all of those protections. You've got their ear now, right? So that is how we open up a conversation to adding supplements to all of our ACA sales in a quick format there, okay? Well, Michelle, there are plenty of guaranteed issue supplements out there. I can tell you Plan Enhancer with sickness, hospitalization, and cancer, heart, and stroke, guaranteed issue. You got cancer, heart, stroke coverage, you've got sickness, hospitalization coverage, and you got accident coverage, guaranteed issue. There are plenty of supplements out there. Well, no, ACA plans cover pre-existing conditions. ACA plans take pre-existing conditions, so you're cool. You're cool there. Yeah. So just important, guys, make sure, yes, Cal, Trio Med's also guaranteed issue. Make sure that is how you're presenting information to your clients so they can see, oh, I was going to pay all that much more for silver, but maybe I could stay on the bronze, build a better package with your help, and then we can get them covered really, really well when they use this stuff. Keep that in your back pockets, guys. Okay, last couple things here, guys. I'll show this one quick. You can enroll either at healthcare.gov or directly on the state exchanges or through the carrier's website directly, okay? If you go off exchange, that would be going to the carrier direct. That might make a subsidy not available. It depends on the carrier. Usually you've got to go through the government to get those subsidies, okay? For re-enrollments, those are pretty simple. Just make sure they're eligible, review the new plan options with each client, make sure, are they on the right plan or do we need to make any changes, okay? And then we just talked about this, but adding supplements, adding ancillaries, so important. And you guys got to open up that conversation, right? And the best way to open up that conversation where they're going to listen to you is showing them, educating them. This is your risk and exposure, and this is what you're paying for it. There are more creative ways to bump up what you're paying to better protect you. And we all know about these. Franco asked, will subsidies apply via Health Sherpa? Yeah, I believe Health Sherpa has subsidies rolled into there. Yeah. Okay, depending on who's in here, if you're with AHCP and you have contracting questions, please hit up contracting@ahcpsales.com or you can call that number. HST, you hit up HST contracting at ngic.com. Very, very important. Write those down.